5 Common mistakes in managing chronic heart disease and how to avoid them. Meet Frank. He's 73, a retired mechanic in Ohio, and he does everything the right way. Every morning, he lines up his pills next to his coffee mug. He takes them. He waits. He checks his blood pressure. And some days, that number still stares back at him like a warning light. So Frank tries harder. He starts walking faster. He adds healthy fruit at night because fruit is supposed to be good for your heart. He takes an extra vitamin just to be safe. And he tells himself, I'm not going to be a burden to my family. But then something scary happens. One morning, he bends down to tie his shoes. And within seconds, he feels that sudden air hunger, like his chest can't quite keep up. Not pain, not drama, just a quiet breath-stealing moment that makes him freeze. Here's the truth most seniors never hear. After 60, the heart doesn't usually fail because you forgot a pill. It often fails because of tiny healthy habits done at the wrong time in the wrong way inside a body with stiffer arteries, slower kidneys, and a liver that processes medications differently than it used to. In this video, I'm going to show you the 5 most common mistakes older Americans make while managing chronic heart disease and the simple, realistic swaps that can lower strain on your heart without adding another medication. And stay with me, because one of the most heart-healthy foods in your kitchen can silently boost the strength of certain heart drugs unless you know the rule. Before we start, a quick note about safety. I'm a health research specialist, and this channel is here to translate medical science into simple daily habits you can actually use. But this video is for education only. It is not personal medical advice. Please don't start, or change any prescription medication based on a YouTube video. If you have heart disease, the safest move is to bring these ideas to your doctor or pharmacist and ask, does this apply to my meds and my kidneys? And if you ever have chest pressure, sudden shortness of breath, fainting, a fast, irregular heartbeat, or stroke, warning signs like facial drooping, arm weakness, or slurred speech, call 911 immediately. If you're over 60, here's the part most people don't realize. Your heart isn't the only thing aging. Your arteries gradually lose their spring. So instead of absorbing pressure like a soft hose, they behave more like a stiff pipe, meaning everyday things can cause bigger blood pressure spikes than they used to. Your kidneys also filter more slowly with age. That matters because fluids and electrolytes like sodium and potassium can swing faster. Something as simple as a salty dinner, a big serving of fruit, or a diuretic food late in the day can hit your system harder overnight. And then there's your liver. Many medications are processed through liver enzymes that naturally slow down with age. That means the same dose that felt fine years ago can become stronger when it's combined with certain foods, supplements, or even dehydration. So the rules that worked at 40, more fruit, more intensity, more supplements, can backfire at 70. This is what I call the healthy habit paradox. You're doing something you think is protective, but the timing, dose, or combination creates hidden strain. Now let's walk through the first mistake. Mistake number 1 is the most common, and it sounds so innocent. If it's natural, it must be safe. For a younger body, that belief usually doesn't cause much trouble. But for an aging heart, natural doesn't always mean low risk. It means you have to think about timing, portion, and pairing. Let's start with fruit. Fruit can be a wonderful choice: fiber, antioxidants, hydration. But some fruits act like a quiet stress test when your arteries are stiff and your blood sugar control isn't what it used to be. Here's why. When you eat a very sweet fruit by itself, especially on an empty stomach, you can get a fast rise in glucose. That surge can irritate the lining of your blood vessels, and in seniors, those vessels are already less flexible. You may not feel it happening, but it can push your system toward inflammation and clot-friendly chemistry. Now add electrolytes. Many seniors don't realize that fruit can carry a heavy potassium load. Potassium is essential, but if kidney function is reduced, large amounts late in the day can be harder to clear. For some people on certain blood pressure medications or with kidney issues, that can contribute to rhythm problems, especially at night. So what's the smarter way? Here's the wiser nutrition protocol. First, choose berries. More often, blueberries, raspberries, strawberries. They're rich in protective plant compounds with a smaller sugar hit. Second, keep big fruit earlier in the day. If you love bananas, melons, or grapes, have them in the morning or with lunch, not as a late-night snack. Third, never eat sweet fruit alone. Pair it with protein or healthy fat. Greek yogurt, cottage cheese, a handful of nuts. That slows absorption and reduces the vascular spike. And now the big one. The healthy food that can turn risky with medication. Grapefruit. Grapefruit and grapefruit juice can interfere with a key enzyme that helps your body break down certain medications. For some drugs, that means more medication enters your bloodstream than expected, increasing side effects like dizziness, low blood pressure, or dangerous interactions. So the rule is simple: if you take heart or blood pressure meds, ask your pharmacist one question: is grapefruit on my avoid list? Mistake number 2, trying to exercise like you're 45 inside a 70-year-old cardiovascular system. Let me be clear, movement is one of the best medicines for the heart, but the dose matters. And for seniors with chronic heart disease, the goal is not to push harder. The goal is steady training without pressure spikes. One hidden danger is sudden intense bursts like fast intervals, all-out cycling sprints, or go-go-go classes where your heart rate shoots up and down. With stiffer arteries, those surges can drive systolic blood pressure dangerously high, sometimes without any obvious warning signs. You might feel fine in the moment and still be stressing fragile vessels. But the bigger mistake I see is even quieter: breath holding. Anytime you strain, especially with heavy lifting, long planks, or hard sit-ups, many people unconsciously hold their breath. That's called the Valsalva maneuver. It can create a sharp rise in pressure in the chest and abdomen, which can spike blood pressure and reduce blood flow returning from the brain. In the wrong body, that's a perfect setup for dizziness, irregular heartbeat, or a scary, almost faint moment. So what do you do instead? Use the talk plus breathe rule. If you can talk in full sentences while moving, you're usually in a heart-safer zone. And during strength training, breathe out on effort. Out as you push, pull, or stand. Heart-smart alternatives that work. Brisk walking or marching in place. Resistance bands or light weights with slow control. Short core holds 10 to 20 seconds while breathing steadily. Sit to stand from a chair, slowly without rushing. Now timing matters too, especially temperature. Cold air can tighten blood vessels, forcing your heart to pump against higher resistance. On the other side, heat can drop blood pressure quickly, especially if you're even mildly dehydrated or on medications that affect heart rate. So avoid extremes. Dress for warmth in cold weather. Hydrate before warm walks. And don't do intense exercise right before bed. Your nervous system needs that nighttime downshift to let the heart recover. Remember, after 60, safe exercise isn't about intensity. It's about consistency, without spikes. Mistake number 3 is a double trap: supplements that behave like drugs and medication habits that quietly sabotage your treatment. A lot of seniors think it's just vitamins. It can't hurt. But once you're over 60, especially with heart disease, supplements can change clotting, blood pressure, and how strongly your prescriptions hit. Here are the big 3 I want you to watch. First, vitamin D megadoses. Vitamin D is important, but high-dose D taken long-term without lab testing can raise calcium levels in the blood. And excess calcium doesn't just go to bones, it can contribute to unwanted calcification in tissues, including blood vessels. The safe move is simple: don't guess. If you're taking more than a standard daily amount, ask for a blood level check. Second, high-dose vitamin E. Many people take vitamin E for circulation, but in high doses, it can thin the blood. If you're already on a blood thinner like warfarin or similar anticoagulants, stacking vitamin E on top can increase bleeding risk. That's not something you want to discover the hard way. Third, vitamin B6 in nerve support formulas. B6 is essential, but chronic high intake from supplements can damage nerves and cause tingling, numbness, or balance problems. People often blame aging when it's actually the bottle they've been taking every day. Now let's talk about medication logistics, because this is where many good patients get hurt. Don't store heart meds in the bathroom. Heat and humidity from showers can degrade certain medications over time. Keep them in a cool, dry place like a bedroom drawer or a kitchen cabinet away from the stove. And one of the most dangerous mistakes: never split or crush extended-release pills unless your pharmacist specifically tells you it's safe. Those coatings are engineered to release medication slowly. Break them, and you can get a dose dump: too much at once, followed by not enough later. Here's your simple 5-step check. Keep a current list of meds plus supplements. Ask any interactions with grapefruit, herbs, or vitamins. Store meds cool and dry. Don't split time release. Use a pill organizer plus alarms. Small logistics, big protection. Mistake number 4 is deadly because it feels normal. Missing the quiet warning signs and calling them just aging. Heart failure and worsening heart disease often don't announce themselves with dramatic pain. They show up as subtle changes, especially in breathing, sleep, and fluid. Here's the first red flag most people have never heard of: bendopnea. It's a simple pattern. You bend forward at the waist, tying your shoes, picking up laundry, loading the dishwasher, and within about 30 seconds you feel short of breath. Not because you're out of shape, but because bending shifts pressure and fluid in the abdomen upward. A struggling heart can't handle that sudden change, so you feel that quick air hunger. If that's happening more often, it's not something to ignore. It's something to report. Next, the cough that gets mislabeled as a cold. A cardiac cough often shows up at night. You lie flat, and fluid that pooled in your legs during the day can shift toward the chest. The lungs become irritated and congested, so you cough. The giveaway is this: it tends to worsen with position lying down, and it doesn't behave like a typical cold with fever, sore throat, or a clear viral timeline. Now here's the simplest and most powerful home tool for catching trouble early: your bathroom scale. Sudden weight gain in a heart patient is often not fat. It's fluid. Use this rule. If you gain 2 to 3 pounds in 24 hours or 5 pounds in a week, that's a call your care team situation. It can mean your body is retaining fluid and your heart is struggling to keep up. The protocol is easy. Weigh yourself every morning after using the bathroom, before eating in similar clothing using the same scale on a hard floor. This is not about obsession. It's about catching a problem early while it's still fixable. Mistake number 5 isn't in your kitchen or your medicine cabinet. It's in your nervous system. Chronic heart disease is exhausting, and after a diagnosis, many seniors quietly slip into fear, frustration, or depression, then blame themselves for not having enough willpower. But mental health and heart health are tightly connected. When mood drops, routines break. When routines break, symptoms creep up. It becomes a loop. And there's another hidden risk that almost never gets treated like a medical problem: isolation. Loneliness keeps the body in a low-grade stress state: higher cortisol, worse sleep, more inflammation, and more cravings for comfort food. You can be taking every pill correctly and still be losing ground if your days feel empty and tense. So here's what works in the real world: the anchor strategy. Don't try to build a new life. Attach one heart-healthy habit to something you already do every day. For example, after I brush my teeth, I step on the scale. After morning coffee, I take a 10-minute walk. After lunch, I do 3 minutes of breathing and stretching. And then you add social oxygen scheduled connection. Like, it's medication, 2 short contacts a week, a phone call, a neighbor walk, a community class. Because your heart doesn't only need medicine. It needs a life that keeps your body calm enough to heal. Let's pull this together. In the next 72 hours, do 3 things. 1. Switch your fruit to berries and pair sweet fruit with protein, especially at night. 2. Move daily, but avoid intensity spikes and breath holding. Use the talk and breathe rule. 3. Start the morning scale habit. Watch the 2 to 3 pounds in 24 hours rule. Now comment 1 to 5 which mistake surprised you most.